Welcome to the Seminole County COVID update. Welcome everyone from the news media. Welcome the public who have tuned in through social media. I appreciate everybody being patient. Today is the first day as we roll out the governor's as well as the county's reopening in the first phase. I would urge everybody to be patient as we work our way through this first phase. We're looking for the public who's been very good thus far through this unfortunate crisis in doing the right things. Our business people continue to do the right things. So we want you to have that patience so that we are able to continue as we monitor and track the data so that we're able to hopefully move to the second phase once the governor and his task force have decided to allow us to do so. Give you an update on Seminole County social distancing for reopening order. All businesses and places of assembly may open and remain open with the exception of the state-closed bars and gyms. Salons and personal service providers may open for retail sales, but the governor's order does not allow for the provision of personal services at this time. Businesses should visit prepareseminole.org to learn more about the county's order, which ensures the following. All employees and patrons must practice social distancing by staying 6 feet apart. For businesses which require employee and patrons to be within 6 feet, both the employee and patron must wear a face mask or face covering. For instance, a car salesman on a test drive considering to purchase a car. If the customer wearing a mask or face covering would impede the service provided, service provider would need to wear a face mask or covering. An example of this are servers at restaurants and the patrons not. Obviously, you cannot eat food if you have a face covering on. Group meetings and training sizes must be limited to allow appropriate social distancing. Limited occupancy to 25% of the maximum allowable occupancy under the fire code here in Seminole County. That is for retail and restaurant establishments, as well as 50% for all other businesses, places of assembly, non-residential, non-medical, and non-lodging uses, and checkout points, queues must be monitored, including staging areas for social distancing requirements, including things such as marking the floors to allow your retail people and patrons to understand what that 6 foot distance is. I think we've all seen that a lot of people may not know or understand what 6 foot really is. So hopefully as we get into this, that will become more prevalent and prominent in people understanding that. Groups of greater than 10 persons are not permitted to congregate in any public place that does not readily allow for appropriate social distancing. Again, that's 6 foot distance between individuals. Although county facilities have not yet been open, we continue to provide services on an appointment basis, and the county has never stopped providing services to our citizens. So essentially, since this has all started, the county and the cities have continued to provide service either on an appointment basis or limited as need be. We've never closed down those services, and I thank our employees throughout the county and cities who've continued to allow things to operate for our citizens. Our parks have remained open with limited services over the past several weeks. That has been the case in the county as well as most cities. Some of them have been closed in some of the cities because of large gatherings early on. But I think that speaks to one of the attributes that we hold near and dear to our hearts here in Seminole County is those parks and trail areas that we have that have allowed some of our people to get outside and do the social distancing, either in a family unit or by themselves, to actually get out, free their minds, try to get outside the house as much as they possibly can and get some fresh air. Our leadership team is preparing to open our various public lobbies on the 11th. So on the 11th of this month, we will start phasing in, opening again the county services building as well as other entities within the city. The county clerk as well as the tax collector have already begun doing a phase-in opening so they can provide additional services as need be. Those will be limited services. We're also installing protective measures to the public for our employees to ensure our citizens and team members are prepared for social distance to operate within the CDC recommended guidelines. We are encouraging our staff to continue to telecommunicate this week. Therefore, if you require county service this week, please call and make an appointment at your convenience. The social distancing for reopening order will apply in addition to the Governor's Executive Order 20-112 for Phase 1 safe, smart, step by step. Earlier this week, I sent a letter to the governor and asking him to consider opening the personal services such as hair salons and barber salons. Myself, as well as other leaders around the region, have had a discussion about this. You saw earlier this weekend when the governor was in Orange County with Mayor Demings talking about this specific issue. Myself, as well as Osceola County, Orange County, and Lake County have made that request. I also sent a letter to the Governor and Commissioner of Agriculture for consideration of reopening the state forest soon. As you know, Phase 1, some of the state parks, approximately 80 of those around the state, are being reopened. However, none of the state forests have been reopened, and this is a concern that many have had in our equestrian community. We have a lot of equestrians throughout Seminole County, Orange County, and the region that often use a lot of these state forests to go out and do their trail riding and so forth, but they can't get access to it, as well as some of our hikers. These include places like the Little Big Econ, as well as the Charles Bronson State Forests. We've asked the governor to consider reopening those, as well as the Commissioner of Agriculture. It's our hope that the governor will soon reopen some of these areas. Of course, as we've heard, the same that we're going to do here in Seminole County, we're going to follow the data. With increased testing, we've had testing today in a couple locations that are overwhelmingly successful, and we've heard of people helping people get to these testing sites. Palm Valley has been one of those in our community, right next to the Orange County, Seminole County border, and it was very encouraging to hear that the property manager at Palm Valley was actually getting people loaded up that could not otherwise get outside and take them to be tested. So that's been a very successful event today. Also at the Altamont Mall, by appointment, we have continued testing there. We are also currently working on and having discussions with the labs and those service providers about additional testing, and that testing will be unveiled as it comes online, and that is related to antibody testing and how that will transform here in our community. So that discussion is being had. Those tests are going to be available, and as soon as we have that information, we'll roll that out to you. The longer we keep folks from working, the greater concern we have for the well-being of our residents. You know, we've talked about this on a number of occasions. You know, our school board is doing great work. Our frontline first responders at the sheriff's office, our firefighters are doing great work out in the community. But as we know, as the economy has turned down, people are confined to their homes, we have, you know, concerns about mental health issues. May is also Mental Health Month, and here to share more information about those services to our residents, we've brought Eric Welch, President of the National Alliance for Mental Illness, and Nancy Jimenez from Hispanic Family Counseling to present information to the public today. You'll hear from the following from the Sheriff Lemma also, and with that, I'll turn it over to Mr. Welch, or Sheriff Lemma, I'm sorry. Got you out of order.
You're the chairman.
Thank you, Sheriff. Yeah, right.
Thank you. Thank you so much, Chairman, and thank you for your leadership on this effort. You know, I'm not going to go through the stats again. The only thing that I can say is we remain pretty consistent to where we were before. We made contact with nearly 400 businesses to this point, have only given warnings to anybody, and have quite literally remarkable compliance with any executive order either at the local or state level. We don't anticipate that changing whatsoever. The key to this is always education, and the members of the Sheriff's Office as well as our municipalities have continued to do that. A couple of important reminders. It really felt great to see businesses starting to open up again today, to see more people on the roads. This past weekend was probably one of the largest, most active trail days that we had here in Seminole County. And a lot of people like to get outside, but this weekend seemed like there was a lot more people there. We want to give the basic reminders again. When you park your vehicle on those trails, we don't want to create any target-rich environment for those people who may commit crime. Make sure you take your valuables, you lock your doors, you hide your valuables. I just ask our citizens to do that. Like the chairman said, this is Mental Health Awareness Month, but it's also Corrections Appreciation, National Corrections Appreciation Week this week. And when it comes to mental health and being aware of that and providing services, the men and women that work in our correctional facility do a phenomenal job with that. We've said before, and the members of our organization believe, that crime and delinquency are symptoms of other problems. And at the top of that list is substance abuse and mental illness. And to be able to get the help and resources that they need during these vulnerable times is going to be key to our mission. It is our responsibility to habilitate as much as we rehabilitate people who are inside of our correctional facility. So this week we pay tribute and show appreciation for all those dedicated men and women that are working on the inside in less visible positions, but are making such a difference day in and day out. Also worthy of recognition is this week is Teacher Appreciation Week. And we show our thanks to the teachers, the faculty and staff, and all the members that are working in our school. Perhaps we have a greater appreciation now more than ever as we're trying to balance those teaching responsibilities with our children. So if you can, send a little note to your teachers, your faculty and staff, and we've always experienced such a great relationship with Dr. Walt Griffin, the members of the school board, and the various principals and administrations throughout Seminole County. With that, I won't drag it on any further because I'm going to introduce a great partner and a friend, not only to the Seminole County Sheriff's Office and Seminole County law enforcement agencies, but Eric Welch is responsible for the Tri-County area as he serves as the Executive Director for NAMI, which is the National Alliance on Mental Illness. And again, tremendous resources and information available through him and his office, and I appreciate the collaboration that we have day in and day out. So with that, Eric.
Thank you, Sheriff, and thank you, Seminole County officials, for shining this spotlight on mental health. May is Mental Health Month, and unfortunately, it could not have come at a more opportune time. A mental illness epidemic is coming. Dr. Ken Duckworth, the Chief Medical Officer of NAMI, said in a recent interview with CNN that mental health is a piece of this epidemic that will have its own waves and its own intensity. And locally, Sheriff Lemma reported that the types of calls related to mental health emergencies have spiked and that the pandemic will lead to a greater mental health crisis and potentially more suicides. The National Suicide Prevention Line is showing a 40% increase in calls, and the National Disaster Distress Line saw an increase of 891%. At NAMI Greater Orlando, we saw a 32% increase in calls to our warm line, with our peak call volume, not surprisingly, coming the week of March 8th. We are seeing not only an increase, but a change in the types of calls we're getting. Our number one request right now is for support. A surprising aspect of our current mental health landscape is what is not happening. While calls are up, Baker Acts and intakes at behavioral facilities are down. What does this mean? People are in need, but they're staying home. They're managing the mental health crisis on their own, behind closed doors. And once these doors open again, a wave is coming. We've all become familiar with the terminology of flattening the curve, and mental health leaders across America are now warning of a second curve, the epidemic of mental health. And in a state where the system of care is woefully underfunded, this epidemic will put an extreme burden on our hospitals and our law enforcement community. And how do we know this epidemic is coming? We can feel it. We're now a nation of grief. We know what grief feels like. Only in this grief, our usual coping strategies have been taken away from us. We're not able to hug our loved ones and cry on our support system. This is creating an entire nation of grief and anxiety. We're all facing loss, the loss of jobs or stopping by our favorite restaurants, the loss of school structure, the loss of visiting our family, or in my case, the loss of seeing my oldest daughter walk across the stage and receive a college degree. With the uncertainty of this future, we are now also a nation of anxiety that are unequipped with the proper tools to manage this anxiety. So we're all asking the same basic, fundamental human question: when will life feel normal again? And experts say these types of internal struggles will continue for many years. This is why, to flatten the mental health curve, we need to start doing the opposite of flattening the COVID curve, which is to eliminate isolation more than ever, to face-to-face connect with our friends and families and discuss the issues and problems we're facing. There are countless studies out there about the dangers of too much screen time, and a recent Orlando Sentinel about zombies posted a warning to all of us: don't become a zombie. And finally, I want to talk about our heroes. We've heard many shout outs to our health community, our doctors, our nurses, our first responders, but let's not forget about another part of our health community, the mental health community. Mental health professionals who've been calling and texting clients free of charge, crisis phone operators that have remained open throughout, and even our own NAMI Greater Orlando Warm Line has never closed, with someone ready to answer the phone and give information and resources. And I can assure you that that phone line never closed, because it personally goes to this cell phone. And NAMI Greater Orlando remains open for those information and resources. Our number is 407-253-1900 or at namigo.org. And there'll be other resources provided by our next speaker. But there are thousands of us across America who have continued to provide mental health and be heroes and give hope with 3 simple words: I am here. So I'd like to close with a blog that was recently posted on NAMI.org, and it's quoted as this: during this difficult time, it is my sincerest hope that people will also look to the many examples of resilience in our mental illness community. No one knows the pain of isolation, loneliness, unemployment, debilitating illness, and life-threatening circumstances like we do. We will rise. Thank you for your time. Up next.
Thank you, Mr. Welch, and all of the leaders present here today. Grief, loss, fear, anxiety, worry are definitely some of the strong emotions that we all have been facing and feeling during this time. But we will rise. We will figure this out together. Not alone, not isolated, together. The Center for Disease Control and Prevention shares in an article titled, Taking Care of Your Emotional Health. Taking care of your emotional health during an emergency will help you think clearly and react to the urgent needs to protect yourself and your family. That's why it is so important that we do take this seriously and try to cope with the stress and all of the emotions that we are managing at this time as best as possible. Some recommendations that have been given by the CDC are: take care of your body, rest, sleep, try to eat healthy and well-balanced meals, meditate, avoid drugs and alcohol. Like it was said previously by our previous speaker, take breaks from watching, reading, or listening to news stories, including the social media. Hearing about the pandemic repeatedly can be upsetting for the adults and the children. Make time to unwind. Try to do some activities that you enjoy and that bring relaxation and peace. Following the CDC recommendations and the county guidelines, continue to stay connected with each other. A phone call to a friend, a text, utilizing a video teleconferencing platform. Stay connected. And get help if you need to. It is okay to get help. We all need it at some time or another. If you or someone you know are feeling overwhelmed with stress, feeling too anxious or too depressed, if you're noticing your children are getting too irritable, or they're crying too much, or they're regressing in behavior, and you have not been able to successfully complete your daily task, or somebody that you know is having difficulties, or your child is having difficulties all of a sudden concentrating and completing their school assignments, please get help. At Hispanic Family Counseling, we're here to help you. During this difficult time, Hispanic Family Counseling has stayed connected and continued to serve our community in Seminole County by providing individual and family counseling via telehealth. We're also offering face-to-face as needed. And we're also providing targeted case management services to help individuals find resources in the community to improve their current quality of life. At Hispanic Family Counseling, we accept most insurances. We offer our services in English and Spanish. Our phone number is 407-382-9079. One more time, 407-382-9079. You can look us up at our website at www.hispafam, that's hispafam.com, www.hispafam.com. There are other additional resources that we recommend should you need them. You can contact United Way. The number is 211, and they're there to provide community resources numbers. If you or someone you know has signs and symptoms of suicidal ideations or thoughts of self-harm, we encourage you to call the National Suicide Prevention Hotline, 1-800-273-8255, or their text line, 741-741. We also have the National Domestic Violence Hotline, 1-800-799-7233. And in case of an emergency, dial 911. Our mental health is really important in order for us to protect ourselves and protect others and protect our community. Stay healthy, stay safe, and God bless.
Thank you, Eric, and thank you, Nancy, for being here today to talk about this most important issue that impacts not only our community but communities nationwide. We sincerely appreciate it. I know that you folks are very busy. This is a very important topic. Thank you for Sheriff Lemma, who takes a huge role on the front lines of this as well, and working through the Sheriff's Office, and many of his people have to deal with this as they are out on the front line each and every day, as well as our firefighters. So with that said, I would also remind you, if you need information as we get opened up and you have questions, prepareseminole.org. If you have a question, the Citizens Hotline, 407-665-0000. Also want to say a little bit about, there's a lot of information out there running around that's false information you'll see showing up on social media, these kinds of things. I would ask you to go to the specific areas of your county. Again, here in Seminole County, that is prepareseminole.org. Other counties have their own direct access and understand that information directly from those emergency centers. Those are the people that have, the copies of the governor's orders, the local orders, also can help put you in touch with assets with questions for your business. I know Orlando Health has put up a website helping people understand how to wear masks and those kinds of things as you get out and socially interact. So with that said, I would like to thank the news media here today for helping us get the message out, as well as all the citizens, our healthcare providers, our first line responders. Thank you very much. We appreciate it. So with that, we'll take any questions anybody might have.
Jay, I wanted to ask, and I don't know if this is something the sheriff would know as well, has there been any businesses that have said, I don't care what you guys say, I'm opening, I need to open?
Well, I don't know if the sheriff, I don't think we've heard that. I mean, I had a briefing just before coming in here today. We haven't seen that. There has been all kinds of chatter, of course, on social media about such things, but we haven't seen that occurring yet here in Seminole County. If we do, then I would expect our law enforcement people or the appropriate individuals to take the appropriate action, but so far so good.
Driving around a little bit today, I wouldn't say the cork exactly came out of the champagne bottle, but there's a lot of people who are on various sidewalks doing dine-in, and when you talk to them, they seem to be very relieved. Any cautionary tale that they enjoy this added option,
Certainly,
but not overdo it?
Well, that's correct. I mean, look, the virus is a serious situation. This is nothing to believe that it doesn't exist. It's nothing to believe that it was some dreamt up scenario, or it's even resembles the flu. Our healthcare providers have told us, and we're seeing this is a serious situation with almost, what is it, I think 70,000 or 60-some thousand deaths nationwide. So what I would urge people is the following. Take it slow, follow directions, keep your social distancing, cover your face when you can, and enjoy the outdoors, but be respectful of the businesses as well as your fellow citizens. Because as we monitor this, the governor as well as local officials are going to have to adjust accordingly. If we see something that's not right or something starts to get out of control, then we're going to have to do the appropriate things to protect the public. So my message would be is get out and enjoy, stay home. If you're working from home and don't need to get out, by all means stay home, but be respectful of those people that are getting out and opening up, as well as the businesses. The last thing we want to see happen is this to break out to be a major problem, concern, and we all have to deal with that.
If I may, and including for the sheriff.
Dave's going to have the questions from Eric really quick.
Oh, I'm sorry.
No worries.
Yeah, real quick. So I know that the whole mental health issue between financial hardship and anxiety and grief and all, it's obviously something you cannot simplify because it's so big. Right. But if I understand the message between the two of you professionals today is that whatever you're feeling that's got you on the edge, don't shut the door, pretend like it's going to go away, and that is to reach out to somebody, whether it's a family member or a professional, because that's the only way you're going to have a relief valve.
It's always been the message of mental health. It's just now heightened more than ever. The message of mental health was always, like I said, we know what grief feels like. We know what major life changes feel like. And during those times, we reach out to our friends and our families and our mental health professionals and our therapists. And so now more than ever, when you're feeling these abnormal feelings, you need to connect.
Thanks.
Okay.
Sure. I'm sorry, what I was trying to ask was perhaps for the sheriff or the chairman. I want to follow up on the enforcement. Sheriff, I know you said earlier that so far businesses have been in compliance. You've checked with, I think you said about 400 plus or so. Eventually, there's a good chance that some businesses are going to stop following the rules or not following the rules to the T. I think somebody mentioned about some of them talking about how they like to reopen even though they shouldn't. What happens then? What do you do? How do you follow up? I know there's been mention by the governor of a $500 fine potentially.
Yeah, so the action was always here in Seminole County a citation, a financial fine, because it did not make any sense for us here to have the risk of incarceration present a greater threat than the violation in the first place. And I think that it's important for all of us to recognize that these rules change weekly, either at the state level or the local level, and not every person is watching every news conference. So I think that education and awareness is a big part of what we've been doing. I think that that's why we haven't had to issue any citations. But let me be clear, if there's somebody that is recklessly endangering the health and welfare of someone else, we will. But we just haven't seen that because our business owners care about their customers. They care about their employees. They care about the environment that they're creating there. So even the ones that say, hey, I'm going to open, it's not like they're open in a reckless manner. The ones that are saying that they're open are doing it with the use of masks because they choose to do that. They're abiding by social distancing. But you know, if we have to take more aggressive action, we will. I just seriously doubt that that will ever present itself here.
You guys were the only county in this area that started with the social distancing orders. Did you get any questions from other counties on how you guys did it and what you guys did or?
Yeah, very good question. The question for those listening, we were one of the counties that first initiated social distancing at the onset of this, and had we been contacted by other counties of how we did that and what was done. I don't know that we were formally contacted. You know, as a chair and a commissioner here in Seminole County, we interact with our counterparts in other counties. We're also on teleconferences constantly, not only on the COVID issue, but economic issues as well as other issues through. So there's always conversation that goes back, hey, what are y'all doing over there? What's working, what's not working? And I find that collaborating and sharing those is for the best of all. So I don't know that we've had a formal inquiry. I've had conversation with other regional leaders about how we did it, what we did, but that would be the extent of it. Anyone else? And what I'd like to say on the one question is about businesses being fined and so forth is this. You know, business people are smart people, and the reality is this. We want people to be safe, but businesses have the obligation to make their patrons feel safe. And what they'll quickly understand is if they're not allowing their people who patronize their business to feel safe, well, guess what? Those people aren't coming to their business. I mean, we're already seeing some of that conversation in other areas of the country where people have said, hey, I'm just not going. You know, in my opinion, you're not being safe, so why would I come into your place of business, put myself in a precarious situation? The unique thing about Seminole County, what the sheriff says, we really truly are blessed with people that really, for the most part, want to be safe. They want the community to be safe, and the business people want to continue to have a business that operates that people are going to patronize. So again, I think we're very blessed in that aspect from that perspective. So with that said, I thank everybody for being here today on behalf of the County Commission, as well as the 7 cities here in Seminole County. I will now turn it over for Gigi to do a Spanish translation of today's press conference. Gigi, thank you again, and we certainly appreciate your time in coming down and doing this on behalf of our community. Thank you.
Buenas tardes. El director de la Junta de Comisionados de Seminole, Zembower, explicó lo siguiente el día de hoy. Agradeció primeramente la paciencia de los residentes mientras se reorganizan las medidas de esta fase. La orden ejecutiva del condado de Seminole, con los requisitos de distanciamiento social para la reapertura, comenzó el día de hoy. Todo negocio o lugar de asamblea puede reabrir o mantenerse abierto, con excepción de los bares y gimnasios previamente cerrados por la orden ejecutiva estatal. Los salones y proveedores de servicio personales pueden abrir para vender artículos, pero según la orden ejecutiva del gobernador no está permitido proveer servicios personales. Se recomienda a los dueños de negocios visitar la página de prepareseminole.org para obtener más información sobre la orden ejecutiva del Condado de Seminole, que incluye lo siguiente. Todos los empleados y clientes deben practicar el distanciamiento social, manteniéndose al menos 6 pies de distancia de otras personas. Para los negocios cuyos servicios no permiten mantener esta distancia de 6 pies entre sus empleados y clientes, ambos empleados y clientes deberán utilizar una máscara o una cubierta de tela para cubrirse la cara. Por ejemplo, en el caso de un vendedor de vehículos y su cliente cuando va a probar un vehículo. En caso de que la máscara o cobertura del cliente impida el servicio a brindarse, entonces el proveedor de servicios debe utilizar una máscara o cubrirse la cara. Por ejemplo, los camareros en un restaurante y los comensales o clientes que van a comer. Las reuniones y entrenamientos deberán limitar el número de participantes para mantener las normas de distanciamiento social. Se debe limitar la ocupación de locales a un 25% del máximo permitido por el Código de Incendios para los establecimientos comerciales y restaurantes y a un 50% para otros negocios, lugares de asamblea y lugares no residenciales, no médicos, no hoteleros. También los puntos de salida y entradas y áreas de preparación, incluyendo los frentes de tienda y comercios, deben ser monitoreados para asegurar que los requisitos de distanciamiento social son mantenidos, utilizando marcas en los pisos o utilizando señales o letreros que provean indicaciones para mantener los 6 pies de distancia entre los clientes. No se permite la congregación de grupos de más de 10 personas en ningún espacio público que no permita mantener los requisitos de distanciamiento social apropiados. Las oficinas del Condado de Seminole continúan ofreciendo servicios limitados o por citas. Los parques públicos del condado también están abiertos a aquellos que deseen utilizarlos, siempre manteniendo las regulaciones de distanciamiento social. La orden ejecutiva de Seminole, con los requisitos de distanciamiento social para la reapertura, está en efecto en adición a la orden ejecutiva 20-112 emitida por el gobernador de la Florida para la fase 1, Safe, Smart, Step by Step. Las oficinas del condado del comisionado Zembower enviaron una carta al gobernador DeSantis el 1 de mayo para exhortarle a que permita la reapertura de los salones. También se enviaron unas cartas para la consideración de la reapertura de parques forestales. Se continúan haciendo pruebas y exámenes de COVID en el condado de Seminole en diferentes áreas, más reciente pruebas en el Altamonte Mall y también en el área de Palm Valley. Es el deseo del comisionado que el gobernador permita la reapertura de estos pequeños negocios de una manera segura y permita a los residentes retornar a sus trabajos. En adición, el sheriff Lemma también ofreció los siguientes avances. Los residentes del condado de Seminole y los pequeños negocios continúan obedeciendo las órdenes ejecutivas emitidas hasta el momento. Hay un recordatorio para los ciudadanos que por favor cuando salgan aseguren sus vehículos para reducir el riesgo de robos. La semana de apreciación para los oficiales es esta semana corriente y también reconoció la semana de apreciación para los maestros, para aquellas personas que deciden enviar sus mensajes de apreciación. También se reconoció el día de hoy y el mes de mayo como el mes de la salud mental. Para compartir más información sobre los servicios disponibles a nuestros residentes, el señor Welch, presidente de la Alianza Nacional para Enfermedades Mentales, NAMI por sus siglas en inglés, y Nancy Jimenez de Hispanic Family Counseling, estuvieron hoy presentes. El señor Welch expresó que es un momento importante para reconocer la importancia de la salud mental. En los últimos días se ha reportado un incremento de las llamadas nacionales y locales para apoyo de salud mental. Se estima que las personas están tratando de trabajar las situaciones de estrés mental desde sus casas y querían exhortar a aquellas personas que los necesiten a buscar ayuda. Por ejemplo, el número de teléfono para aquellas personas que quieran contactar con la organización de NAMI, que continúa ofreciendo servicios de apoyo de salud mental y ayuda a los que los necesiten. Ese número de teléfono es el 407-253-1900. La señora Nancy Jimenez también expresó que las emociones de miedo y preocupación son normales durante esta época y especialmente con lo que está sucediendo con el COVID. Pero es importante mantener ciertas medidas básicas, como por ejemplo dormir al menos 8 horas, tomar alimentos saludables, meditar, ejercitarse y mantenerse conectados a otros, aunque sea por texto o a través de los medios de comunicación social. Busque ayuda si la necesita. Puede llamar a Hispanic Family Counseling al 407-382-9079. La agencia provee servicios de telesalud y también puede visitar su página web www.hispafam.com para verificar otros servicios ofrecidos. También pueden buscar asistencia a través del United Way, marcando el 211 en su teléfono. Otras líneas de ayuda disponibles son la Línea Nacional de Prevención del Suicidio, que puede llamar al 1-800-273-8255, la Línea de Prevención de Violencia Doméstica al 1-800-799-7233, y en adición, para más información general sobre las recientes informaciones del Condado de Seminole, puede visitar la página de prepareseminole.org o llamar a la línea de información del condado al 407-665-0000. Muchas gracias.
Thank you again, Gigi, and that concludes our teleconference or our press conference for the day. Thank you all very much.